Kampala Capital City Authority, KCCA, is an organization that is tasked with the administration of Kampala City. KCCA has set upon improving service delivery in the city, and among the many sectors that need overhauling is the education sector. Kampala has over 123,000 primary school pupils. Half of these are in 400 private schools. The other half are in KCCA schools. These are just 81. This is a result of Universal Primary Education UPE, a program set up by the government to provide free education at primary level. This program saw an increase in enrollment without a corresponding upgrading of infrastructure, causing overcrowding in the classrooms.
The issue is even further compounded by the fact that because of the relatively good standard of education in Kampala, you get an influx of children who are coming in from outside the area of jurisdiction.
There is a need for more desks, textbooks, stationery, and other scholastic materials. The facilities that these students come to are in a state of disrepair. Some schools were constructed as far back as the 1950s and have not had any repair done since. The classrooms are dilapidated, the floors cracked, the roofs leak, the windows are broken, and the students are exposed to the elements. There is no fencing, and security cannot be guaranteed. The teachers at one of the schools are put up in dilapidated unipods. In a nearby school, the accommodation is also in bad condition. Some schools have housing with asbestos sheets, which have been condemned. There is no space, no privacy, and the buildings are simply falling apart. Without proper accommodation, there are fewer teachers.
If you are looking at improving the quality of education in any system, education system, you need to ensure that you take charge, you take care of the welfare of our teachers. You'll find that we did not have very good accommodation for our teachers. But as you know, we are having teachers coming from all over the country, and they can only be accommodated within, if they are going to meet the needs of being able to start school at the right time and also be able to make an input during the time when they're in school.
Daphne, a 9-year-old, walks 1 hour to school every morning. She will go without a school meal or drinking water until 5 p.m. Like many others at this school, she cannot afford to buy anything from the school canteen.
The school doesn't give us food, and sometimes we be hungry.
As you can see, most of the children are playing, they are not going anywhere to eat. Feeding is one of the reasons why there is poor performance.
KCCA has provided dustbins to the schools as part of a bigger campaign to improve sanitation. But there is still a need for running water to facilitate proper hygiene in the toilets.
We have a pit latrine with 4 stances, 2 doors, one for girls, one for boys. Then a waterborne toilet. This one is blocked completely, and most of the time we suffer.
The latrines are falling apart. There is no toilet paper, soap, or sanitary towels for the girls. Some toilets even have no roofs. Across the city, at the police children's school, there is even a bigger problem. Their only source of water is a spring well, from which the children fill their drinking bottles. The water has not been tested to find if it's safe to drink. There are no clinics at the schools. No provisions are made for extracurricular activities. There are no computer labs and no sports equipment. The problems may vary from school to school. What is common, though, is that nearly all of them are based on lack of funds to either repair or expand their infrastructure. This same situation is replicated in KCCA health centers. At all the 9 facilities under KCCA, patients wait over 5 hours in long queues to see the doctor. the waiting areas are overcrowded. Some patients wait in the compounds, which are now extensions of the overcrowded waiting areas. Some are standing. There aren't enough seats, and the ones in use are also worn out. This is a delivery bed that is actually still in use. There are no stretchers or wheelchairs. The patients have to wait in turn to use the one weighing scale. In the maternity ward, there are 2 mothers to a bed. The beds have no plastic sheets, no bed sheets, blankets, or mosquito nets. These rooms have no curtains. The beds in the inspection room are worn out. There are no screens and no partitioning. Some health centers have no delivery wards at all. Pascal has only 2 weeks left to full term, but she has no idea where she will deliver from.
We expect to deliver from here, but we don't have the delivering place. We would expect the government to help us to build for us the room for delivery.
There's a likelihood that these mothers end up giving birth at home, of course, which is a risk to the mother and the child.
The staff on duty cram into a small office. 2 broken beds in the corridor are used as their rest area. There is broken or rusted furniture and tools everywhere. They have no scrubs or emergency kits. The drugs they dispense are only for the most basic ailments, and even then, there aren't enough of them. There are no incinerators, and medical waste is disposed of in the toilets. Paint on the walls is peeling, and when it rains, the roofs leak, bringing work to a complete halt. The electric wiring is bare and needs to be overhauled. There's no generator or solar panels for the standby supply of electricity. These centers have no ambulances. There's a need for X-ray and ultrasound machines. There are no dental facilities. For now, the staff in these hospitals struggle just to deal with simple malaria blood samples.
Currently, we even have no BP machines, a simple equipment which should be in the hospital. We are just there suffering. All we had are already worn out and old.
The facilities are in dire need of repair and refurbishing, but every day, more and more patients come to the health facilities and the students come to the schools. As part of the larger transformation taking place in Kampala City, KCCA is making efforts to rectify these problems.
As an authority, we cannot do this on our own, and we think that we can interest also development partners to be able to access funds.
KCCA is approaching funding agencies, corporations, faith-based organizations, the communities, and parents to make donations to raise the funds necessary to reconstruct the schools and medical centers. Pascal, Daphne, and a whole generation of students and patients are counting on it.